let's go ahead and talk sacrum. So the sacrum is the last part of our spine. We started lumbar, worked our way up thoracic, cervical, and now we're coming back down to the base of the spine. So the sacrum has, in your notes it says 4 to 5 fused segments. We usually say a range, but 5 fused segments is what we're looking at. So you have 5 sacral vertebrae that fuse. When you were born, they are separate vertebrae bones or vertebral bones, and then they will fuse together over time. They create this fused triangular shaped bone that we see here. So when we number these, we start at the top, which is right up here, and this would be S1, S2, S3, S4, and then S5 for the sacral 1, 2, 3, 4, and 5. Now here we usually say when you go lower in the bones, they get larger because they carry more weight and support more weight. Well, the weight distribution comes through the lumbar spine and then gets put onto S1 in the sacrum at the base of the sacrum and gets pushed out here to the lateral ports called the sacral ala, and then gets shifted into the hip bones or the os coxa and down into the lower extremities. So here, the S1 and S2, S1's the largest, followed by S2, and then it keeps getting smaller as you go down. Now, some terms that I just mentioned about the sacrum. S1 has this, across the top, has this broad base. So the top of the sacrum here, we would call this the sacral base at S1. Now, right in the center of the body of S1, so where I have all these S1, S2, these are all the body. This right through here is already labeled for you. This is the sacral promontory. This is that anterior lip or ridge of the superior body of S1. Then, out to the side here, there's this structure called the sacral ala. The ala is formed by S2 and S1 transverse processes fusing. So I wrote ala for sacral ala out here, but I'm going to shade this in blue. All of this area here is the sacral ala. Okay. Now, the structures that are the transverse processes fuse together. They're no longer true transverse processes. So between S1 and S2, 2 and 3, 3 and 4, 4 and 5, these lateral structures will fuse, and they will form these openings on both sides. And we have the 4 sacral, anterior sacral foramen, which are tagged right here. This is for sacral nerves to come out of. Okay. Then if we turn the sacrum and look at the back side, this is an anterior view. So then if we look at the back side, we can also see that there are posterior sacral foramen for these sacral nerves to come out. So off the bottom of the spinal cord, we'll have nerves come down, sacral nerves that go anterior and both posterior. So we can see the anterior, posterior sacral foramen. Now, before we leave the anterior side, a couple things I want to talk about is we have these fusion lines that will occur between the sacral bodies. We will call these the anterior sacral crests. These are the crest or ridges, if you will. That's where the intervertebral disc would be between normal vertebrae, but in the sacrum they fuse together. Sometimes in individuals, the spaces between S1 and S2, for instance, most commonly will not completely fuse together, and they'll have this little residual disc that will sit in there. Not a big deal to necessarily know. Okay. And then before we go to the posterior side of the sacrum, if we look at the sacral ala out here on the lateral portion, so right here, this is looking at the anterior sacrum. This is the sacral ala out here. If we turn this sacrum laterally to face the wall this way, there's this big portion on the lateral sacral ala, and this is for articulation with the hip bones, that os coxa, and so they can articulate out like this. When you look at this lateral portion, I'm going to draw this over here. So we'll draw our sacral base here, so here's the base, and then we're going to draw this over this way. So down here's our apex here, and this is a lateral view. So this up here would be This is the S1, so I'll write S1 right here. That would specifically be S1, and we'll say sacral promontory. That's listed up there for you. Okay, so now on the sacral promontory, there are two places on this lateral portion. There's one structure that looks like a backwards ear presentation, and it is very smooth, and this is called the auricular surface. This is to articulate with the auricular surface of the ilium that we'll talk about once we get into the lower extremity. And then behind the auricular surface on the lateral sacral ala, we're going to have this rough area with these different bumps and stuff on it. This is called the articular surface. Okay. And this articular surface is going to have this bump on it called the sacral tubercle. Okay. That's the sacral tubercle. Again, the ilium are going to attach and articulate there, and then the weight distribution is going to come down through the spine, shift out from S1 into the lower extremities, into the hips. Okay. All right. This would be our anterior side. This would be our posterior side this way. So we can even put that in our notes. We put on here, this is anterior, this is posterior. When you're studying this in lab today, make sure you look at this lateral view. All right, then if we turn the sacrum to the posterior side, here we can see the sacral ala again. But if we look at this structure, only S1 will articulate, and so we have superior articular processes. Again, we have the facets right here on both sides. We only have we have the superior on both sides, and then the facets that are on them. Then in here, where we would call the vertebral foramen on the other on all the other vertebrae, we have what's called a sacral canal, where the sacral nerves run down, and then they branch out to both sides. They go through the anterior and posterior sacral foramen. And then down here at the bottom, the coccygeal nerve will come down to innervate over the coccyx area. But we got this region, or this opening, on the caudal end of the sacral canal, and this is called the sacral hiatus. So this hiatus is the actual opening or bridge over that. Okay? Leading up to the sacral hiatus, we have bony structures that are kind of remnants of spinous processes. These are called the median sacral tubercles. In your notes, it's called the tubercles of the median sacral crest. I don't care how you say it. Sacral tubercles of the median crest, or either way is fine. Okay. That's it for the sacrum. Last thing, if we go to the next slide, it's the same diagram, but it talks about the tailbone or the coccyx. Here, this is the tailbone that attaches to S5, or the apex. We have 3 to 5 fused segments. These are vestigial structures of a tailbone. We call it our tailbone. On the test, the only thing I would do is I would identify or tag the coccyx, and you just identify it as the coccyx. There's nothing else to really say. It's that tailbone. So 3 to 5 fused segments. You can see here, this diagram shows 1, 2, 3, 4. There's anywhere from 3 to 5. It's really not any significance if you have 3 versus 4 versus 5. It's a vestigial structure that's not really used anymore. Okay, that's it. That's our axial skeleton. We're finished.